seem to be working here. Good evening, everyone. My name is Elizabeth McClellan, and I'm very happy to be here this evening. And I'm from Maine, from Portland, Maine, and I have a little sign-in sheet if you wouldn't mind signing it. You don't need to put your email down, but if you'd like to, because you might want more information about what we do, that would be great too. So I'll just pass that around, and I have a pen right here. Thank you. So I'm here this evening to talk a little bit about Partners for World Health, which is an organization that I started back in 2007. I made it into a 501c3 in 2009. But I need to kind of give you a little bit of an introduction on how I have ended up down here because of Mr. Creer, who is here this evening, your past president. And we received last fall, after his wife passed away, Jean, several monetary donations to Partners for World Health in her memory. And we didn't know who she was. And we didn't know Mr. Creer. And so we found out through doing some research who this man was. And we called him up and we started talking to him. And then I said to him, someday I'll come down here and make a presentation in honor of your wife. Because Jean was a registered nurse and for many years was very involved taking care of patients, obviously, in hospitals and nursing homes, but also commenting about the major inefficiencies in our healthcare system and the amount of waste that we have in our healthcare system and all of the things that are being discarded. And so we really want to thank you, sir, for telling your friends to make those, to have your friends make donations in her name and in her honor, because we are doing a big-time thing in Portland, Maine, collecting medical supplies, discarded medical supplies. Before I get going, however, in that description, I want to talk a little bit about what life is like on the other side of the ocean. Now, this lady on the left is a picture I took in December in Thailand. She's 60 years old, but she looks 80 because of the struggle and the difficult life that she's had to have in all of her years living in her home country. And on the right is this little boy and his mother that are gathering plastic in Bangladesh. And you can tell by looking at this child that he's malnourished because of his big tummy, and he's also, you can see his ribs. And so because there's no food, they go into the dump and they manage to collect food and collect plastic to be able to recycle it. This is a good example of what happens in the developing world when people are saying that people live on $1 or to $3 a day. This is true. This is exactly what's happening. People are living on that and struggling. Another example of Myanmar, this is in Burma, carrying patients when there are no ambulances. So people in our world are definitely having difficult times, as well as patients in our world where they're so close to each other in big wards where they have a tremendous amount of infection. And so all of these things are going on in our world. And this is something that I decided I wanted to do something about it. I'm a registered nurse. I lived and worked in Saudi Arabia for 10 years, and I had the opportunity to travel all over Southeast Asia, the Middle East, and Northern Africa, and visited hospitals in Pakistan and Sri Lanka especially. And that's where I saw the fact that they didn't have enough medical supplies. They didn't have enough beds, wheelchairs, walkers, dressing supplies. So I said, someday when I go home, I'm going to do something about that problem. And so back in 2007, I started collecting medical supplies at Maine Medical Center, which is our level 1 trauma center here in Portland, Maine, and went to the CEO and asked him if I could just put a couple of boxes out and just educate the nurses and the housekeepers to save all the things that are left behind in a discharged room. Now remember, if you leave all that behind, those are things that your health care insurance or someone paid for. And so that's all going to go to the dump. And so I started collecting that, and now we have we have 4 big warehouses in Portland, Maine. In the state of Maine. We also have 2 spots in Vermont. We're collecting from New Hampshire, Maine, Vermont, and also Massachusetts, 16 hospitals and nursing homes between Worcester and the Cape. We collect these discarded medical supplies and equipment, consumables and equipment. We help to lower the cost of health care because we take it all away for free. and we come down and pick it up, and we keep track of all of that weight. So if Maine Medical Center or University of Mass Memorial gives us 100,000 pounds of discarded medical supplies, that's 100,000 pounds that they didn't have to pay for to get rid of. So when you think about that, when big hospitals have $350,000 budget to get rid of what they call trash, which in many instances is something that can be reused or reprocessed and then or used in a different way, that's a savings to hospitals. And we're spending so much money. Everybody knows in this room how much healthcare insurance costs and what the big issue is here. So we impact our environment, we lower healthcare costs, and we do the right thing by giving it to people that are less fortunate. Many times overseas, we're shipping a container tomorrow to Malawi and 2 more in October to Uganda, but also back to the general public, especially to homeless shelters, food pantries, and other private citizens in the state of Maine and Vermont. And we'll be expanding that program in 2019. We also organize volunteer opportunities and a big medical mission program. So this is how it started. This is my house. So when I started collecting medical supplies, I collected in a year and a half 11,000 pounds of discarded medical supplies, and there was no place to store them in the hospital, so I brought them home. So everything behind my kitchen is on the left, is my cellar, and it's full of discarded medical supplies, and that picture on the right is looking into my dining room. So they were under the dining room table, they were on top of the dining room table, they were everywhere, including my laundry room and my downstairs bathroom and my cellar. And then in September of 2009, we moved it out and we weighed it in the driveway, and it came close to 11,000 pounds of medical supplies that were saved from the landfill. And then we moved it to the first warehouse, and this is where we are now. This is our headquarters in Portland. It's a 15,000 square foot building at 40 Walsh Drive, and this was last Christmas when we had University of New England students down there volunteering. And we also have another 15,000 square foot building at our Canco Road, which is our shipping center, and that's where the beds, the wheelchairs, the walkers, the crutches, the exam tables, the Hoyer lifts, all the stretchers, all of the boxes of the medical supplies, consumables that we have reprocessed are also stored, and where the containers come in, like tomorrow morning. And we'll load up that container. It'll hold between 15,000 to 18,000 pounds of medical supplies, 20 beds, 10 wheelchairs, 50 pairs of crutches, 50 walkers, and on and on and on. It's full from the top to the bottom because I refuse to ship air. So we always are pushing more and more things into the container. And it is worth $200,000 to $250,000 of medical supplies.
Per container?
In
one container?
In one container. And we know that real value. We don't call a real value for a bed because the bed's used. But when we start adding it up, it ranges between $200,000 to $250,000 in every container that goes out of there, overseas, to India, to Africa, Asia, and sometimes South America. We also have another warehouse in Bangor and way up north near the border in Presque Isle, and then 2 in Vermont, 1 in Burlington, and 1 in Bethel, and a lot of these other sites, drop-off sites as well. We are looking for warehouses, cold storage here in Massachusetts, like somewhere between here and Boston. So if you know of anyone that might like to donate 3,000 square feet or get involved in this program, I'd really love to talk to them, and I'll be happy to share my contact information before I leave. Now this is just a quick example of what we would find left over in a room. That's all going to go to the trash. And we bring it home, bring it back to our warehouses, and we reprocess it. We put all those cotton balls never used in a Ziploc bag, and we send them as non-sterile cotton balls or non-sterile gauze that we might take out of a package that says it's expired because the date is September 1st, 2018. Even though we know it's still sterile, we cannot send a expired product overseas, so we have to reprocess that. And this is how it comes in boxes and bags. And we have to go through every bag and every box at the big warehouse. And at the bottom, you'll see the macro sort table and all of these bins around. And so volunteers come and they pile everything on that table and then start to sort it out. And then we start to box it and count it. This is an example of what's in the shipping center. These are operating room lights that are in there, cardiac chairs, scales, laminar flow units that are used to make chemotherapy, beds and boxes. Huge amount of large items are coming in. If you know of anyone or any facilities that are getting rid of biomedical equipment like EKG machines, defibrillators, centrifuges, we need all of those things. We have a volunteer biomedical engineers that come by to check all of these machines and make sure they work. We don't send anything that is broken. So who does all of this? Volunteers. This was an organization made up of entirely volunteers until a year ago, including myself. I am a volunteer. I don't take a salary, but I couldn't do it anymore as about a year and a half ago. It was just too much. 7 days a week, trying to run an operation, organize containers, people emailing you, can I have a container? How do we figure this out? And all these volunteers. So last September, I started hiring people, director of operations, a director of volunteer coordinator, a bookkeeper, someone to manage our big warehouse. We have 5 employees now, and we'll have 2 more before the end of the year, which should be able to manage this. And we have over 400 regular volunteers that are helping and coming down. We also run programs Tuesday through Friday for developmentally special needs volunteer programs. And this is a group from Goodwill of New England, and they have been coming down to our facility 4 days a week for the last 6 years. And we have 3 other groups that come morning and afternoon shifts. And we also have a very large retired senior volunteer program. And they come down a variety of different times. Our oldest volunteer is 87, and he probably is down there 24 to 30 hours a week. It's a big social opportunity, so we have a variety of different jobs for everybody to do. Sit down, stand up jobs, easy jobs, difficult jobs, whatever you want. Answer the phone, take information off the computer. We have a variety of jobs. And so I was talking this evening to Mr. Creer about this because maybe you all might want to come for a field trip. It's about a 2-hour drive up to Portland. We'll be happy to show you around and what our operation does and how it works, and then you can stay for a couple hours and volunteer. We'll divide you up in groups, and it'll be fun. It's just a thought. Then you'll really get the full picture of what this is all about, because this is something that should be in every state. This should be in every state in our country, because every hospital and every healthcare facility, hospice services, home health services, they are throwing everything out. It is just a challenge that we have in our healthcare system. So I want it all, because there are so many challenges on the other side of the ocean, and we should be thinking about that. And we should be thinking about our people here in our country and the people in Puerto Rico, for example. We've sent 4 containers to Puerto Rico from the state of Maine, 4 huge containers of medical supplies that have been distributed to hospitals in Puerto Rico. And now we're able to offer things back to the general population. Someone that might need a shower chair in their bathroom and they don't have the money to go to Walmart and pay full price for it. We have those. We don't need shower chairs in the middle of Bangladesh because they don't have showers in this hospital. So what are we going to do with that? Put that plastic in the landfill? No. We have to figure out how to be able to help our people here in our country as well. So students, again, we have large groups of high school students and college students that come down to help sort medical supplies. This is just a list of countries and places where we have sent our containers, as well as people that have hand-carried our medical supplies on various medical missions. This is loading a container. As you can see, we don't buy our own boxes. That's a big expense. I mean, I'd love to have a nice white box with a big Partners for World Health label, but it's too expensive. So we reuse all of those boxes things that come in. We put our labels on them, and we create this huge manifest. It all has to be done correctly. And let me tell you something, this is nothing that you learn in nursing school. I didn't learn any of this in nursing school. So it has been a challenge, but it's been figure it out. I did learn that in nursing school, 3 words, figure it out. And that's exactly what I've done with this, along with many volunteers. And then they head out of here from Boston and New York on container ships just like this, to Europe sometimes, and then offloaded onto another ship to go into Africa and around the Horn into Southeast Asia. So we have a major local give back program that we started a couple years ago. For example, we get a lot of adult depends and pull-ups and diapers for adults. And that's a product that was made here in this country for our people. It isn't something that is typically used in Africa and other places in the world. And so we were getting a lot of this from half-open packages from hospitals or private individuals that bring by things that they don't need anymore, that they haven't used. And there's no reason to throw away the package when you only use 2 out of the 10. So why are we doing that? So we bring all that in, and then we reprocess it and we repackage it. And then we were creating all of these boxes, and I said, I can't send 50 boxes of adult Depends to Africa when they don't use those. That's being unethical about providing medical supplies, because they really need the sterile needles and the syringes, and they need the wound care supplies. So we had so much of it, we decided we're going to give back the adult Depends, the bed pads, and personal care items for free. And so we called up different organizations like senior centers and food pantries and other organizations that have different programs for the elderly, and we told them, you can come by, bring your truck, bring your car, just come on by and we'll just fill it up. And then they take it back and they're able to give it away. Because a V&A service that might get this from a patient's home cannot turn around and give it to another patient. It has to come to us first. Because remember, we're not allowed to do that. But we're an organization that just collects it and reprocesses it, and we want to give it back for free. And so many people are taking advantage of that. We also have a medical supply donation program, and for a very small amount of money that helps to support our mission, we offer electric wheelchairs. We don't send electric wheelchairs to Africa because of the challenges. Number one, the lack of electricity. You need electricity to recharge the battery all the time, and that's very scant. And then other reasons are because of the roads. There are no roads, and electric wheelchairs don't work very well on dirt or in mud. And so we leave those. We have a big supply of those for people that need electric wheelchairs that cannot afford to pay $10,000 for an electric wheelchair. So they can come to us and have one for $200. So it's a very big difference here. We provide give-back programs at Christmas time to the local homeless shelters in three cities in Maine and also in Burlington, Vermont. Hospitals in need. This is a hospital in Tanzania. The blue things hanging down are from mosquito nets, but see the beds and see the IV pole. And then another picture of an OB unit in another facility. This is in Burma. And this is what we send. These are the beds. These are the IV poles. Those are striker beds and hill room beds on the top, and on the bottom are nursing home beds that are crank beds. And those are the best ones because remember, they don't have electricity 24/7, and the other beds on the top need electricity. And so those are the different types of beds that we receive and we pick up. We go all over New England now and pick up these beds. And this is a table to deliver a baby on. Not very comfortable and not very safe, nor is it very clean. And this is what we send. These are exam tables that you would have sat on when you go to visit the doctor. And those are pristine exam tables. There's nothing wrong with those. And the reason they're with us is because the capital equipment budget came through and they said, do you need anything new? So they ordered 6 new exam tables. Wow. And when they called me up and they said, will you take these? And I said, are they damaged? And they said, no. And I said, sure, we'll take them, but why? Well, the new ones just arrived. If you don't take these, they're going to the dump.
Oh, waste.
Big waste. So these are examples of things that are oxygen masks that are used on hundreds and hundreds of patients. In this country, when you go into a hospital, you have your own oxygen mask, and you never get one that would have been used by someone else, obviously. But this is what we send. We disinfect these. This is not the ones that you just saw. Those are from Bangladesh, that are being used all the time. That's not something that we do here, and then we send them clean and oxygen masks and oxygen tubing. We also run medical mission programs throughout the world, and this is just a team of doctors and nurses and physical therapists and sometimes pharmacists join us and students. We usually take 6 students, 6 college students or medical students, nursing students, could be engineering students, but students at the college level on these medical mission trips, and they've had an incredible learning experience about what it's like to give back to people that are so less fortunate than we are. And this is a project that I started a couple of years ago in Senegal and Uganda called Project 10,000. And I said to people in Maine, I said, we're going to go over there and we're going to educate 10,000 pregnant women about complications of pregnancy, and we're going to give them their own birthing kit that we have made out of all of the items that were headed to the dump. And it is for a normal delivery, and it's everything that a midwife needs, including the cord clamp, the scissors, the other clamp, the blue bob syringe to suck out the baby's mouth, and all of these things in this one little package, and we give it to them at the end. And then we did that last year in Senegal and Uganda, and this year as well, and now we're up to 1,200 pregnant women that we have interviewed and that we have provided these birthing kits to. So we're going to get there. We're going to get to 10,000, even though somebody said to me, you'll never make it. Not a good thing to say to me, because I am on a mission here. And so another example is Senegal. These are the fish ladies that we provide primary health care to on the beach in Senegal. And we are their only source of health care services for free every year, and we go there for a week and spend a week with the fish ladies on the beach and provide these services for people for free. And we carry all our medical supplies with us that we bring from the United States in bags that we carry over. Another opportunity in India this year where we had physicians and nurses in this group providing education and training to nurses and nursing students, as well as surgery with our physicians, by our physicians teaching surgeons over there. A big hospital taking care of cancer patients. And so what can the Lions Club do? Lots of things. If you wanted to support a shipment, a container, they range in price between $20,000 to $25,000 because we have to pay for the shipping and processing fees to move it from Portland, Maine all the way around to Bangladesh, for example. The containers going into Uganda or into Malawi, those containers are more expensive because those countries are landlocked. So they arrive in the port on the coast of Africa, and then they have to be trucked in. To Congo, they just today learned that it's $7,000 to move one container between Dar es Salaam and Tanzania to the location in Congo. That's just the trucking. And it's another $5,000 just for the shipping, and then plus the processing fees. We could partner with another Lions Club. Maybe, I'm not sure if Lions does international grant funding. Do you do that? Yes. So, there's a possibility of finding other Lions Clubs in the international world and partnering with your Lions Club to come up with an international grant together. And we know, we have a lot of contacts in different places. I don't know any Lions Clubs yet over there, but I do know Rotarians, and we have done a few Rotarian grants that way. And there are big needs over there that together, with a Lions Club in Africa someplace and your Lions Club, that we could actually write a grant. Collect wheelchairs, walkers, crutches, and if you wanted to do that kind of a collection and have it on a Saturday and reach out to everybody in this area and say, look, bring your wheelchairs, your walkers, your crutches, all of your rehabilitation things, your walking boots, your knee immobilizers and things that you have at home that you aren't going to need anymore. We could come down here with our truck on a Saturday and make a big day out of it. And all of that stuff could come in, and we could just put it right in the truck and take it up, and you wouldn't even have to store it anywhere. That's a good thing, because we know there's no storage, having listened to the garage sale that's coming up and how we really want that to move on. And so there might be some other opportunities, and we'd love to have you come up for a tour, and maybe volunteer sometime if you'd like to make the trip up on a Saturday or on a day when you might want to do that. And I also have some information here that I'll be happy to share of all of the items that we do collect, and some cards here and some other information. And I'd be happy to take some questions.
Malawi. Yeah.
What about it?
Well, what do you think?
About Malawi?
Yeah, we work pretty well.
You want to do something with Malawi?
No, I don't want.
Well, we work with Brian, Dr. Alisse from Bridges to Malawi. Sometimes. So we give him some funding money, and he comes and gives us a presentation of what he's doing that year and stuff like that. So we work with him.
Is he a physician from here?
Doctors Without Borders.
Doctors Without Borders.
Oh, Doctors Without Borders, okay. Yeah, well, Doctors Without Borders is a little different, because Doctors Without Borders is an organization that goes into conflict many times initially, into conflict situations and provides that initial health care and then sometimes stays. So is he over there now working in Malawi?
I don't know that he's over here now. They make a trip.
No, he usually goes in April.
April.
He goes in April.
And the reason we're associated with him for the most part is glass collection. Last year, we collected about 2,300 pair of glasses, and the students that go with them take the glasses and put them in the overhead compartments.
Mm-hmm.
And that we help fund some.
That's how we got involved with him.
Great. Well, we also collect glasses, and we'd be happy to donate the glasses to you. Because I don't take glasses like these glasses that are donated over. What we do is we get a huge number of reading glasses donated to us from America. We have a contract with them. And they send us all the reading glasses, all the different sizes. And so when we go on our medical missions, we carry like 500 pairs of reading glasses with us. And then we run these clinics for these people. And they just come in and we say, you know, how does this look? And, oh, it's blurry. And then it's a very rudimentary way, but they go away happy. Everybody has a smile on their face because they're getting a pair of reading glasses and they can actually read or they can actually see something that's a little bit better.
They have some kind of sizing machine they run these things through. So even if you had glasses like that, they could use them.
We'd be happy to collect glasses for you because people donate them. You know, what goes around comes around. Let's help each other out. So you know, because we don't take these glasses over there because we don't have a way of they can't wear my lenses. You really need to have somebody that knows what they're doing with that. So we give you the glasses. You can have those for sure.
Do you work with hospitals in Boston?
Yes, we're working with Tufts Medical Center now at University of Mass Memorial out here in Worcester, at Spalding Rehabilitation Hospital, and a lot of smaller hospitals, South Shore Hospital. I'm not big enough to be able to go into BU Medical Center, even though they've called me. And what? No, not yet. Not yet. It's not that I haven't wanted to go in there, but if you start something like this at Beth Israel Hospital, which is, what, 300 or 400 beds, it's going to be huge. Mass General, 1,000 beds, it's going to be huge. And so we just are not big enough to be able to handle that right now. But if somebody were to find me a warehouse down here, we could handle it. And then we find out about some volunteers, because once I go in and talk to nurses and other administrative people in hospitals, like at Spalding Rehabilitation, they latched right onto this, and they created their system. And so they have a system now where they collect it from the units and from materials management in the storeroom, and they move it themselves down to the loading dock where we have pallets and big Gaylord boxes, and when 3 Gaylord boxes are full, they call us and we drive down and pick it up. So that is really working.
Children's Hospital, and you get small things in your inventory.
Excuse me?
Children's Hospital is mega huge.
I know, they're all mega huge. Mega huge. I know. I went to nursing school down here. I know how big they
They're
are.
all within 1 mile of each other, so you didn't have to move the truck that far to pick up all the stuff. One truck, and a couple trucks.
Yeah, well, a space down here would be really good.
I hear about an organization, I don't remember the name, but is another organization doing the same thing?
There's a big organization in Atlanta called MedShare.
Here in Massachusetts?
There was as far as I know, yes, there was one called IMEC, but I don't know what they're up to these days.
The name of Deborah Horwitz is familiar to you?
The name of what?
Debbie Horwitz.
No.
Because I hear that she is involved with something like that. She's a nurse too. And they pack like a surgery equipment. And when the shipment arrives, it's already to put in the building and it's ready, it's sterilized and everything. And I know they are doing that. And it's from here, from Massachusetts. But I don't remember who is doing that, collecting all the surgical equipment.
Right. Well, we're doing the same thing. You know, we're sending the beds, the operating room tables, the anesthesia machines, all of those things as well. So I'm not sure exactly who's doing that, but if you don't need to send things that are totally sterile, like surgical instruments, because those surgical instruments, they can sterilize over there in autoclaves. And we also send them an autoclave, usually. But things like gauze, that is expired, you cannot send it if it has an expiration date on it. So we have to take it out of the package and put it in a Ziploc bag and send it as non-sterile gauze, and then they can sterilize that in their autoclaves over there. So there's a lot of different ways to reprocess this stuff in our country than just make the decision that we're going to send it to the dump.
There's a facility in Berlin where they gas whole truckloads of medical supplies.
Yes, there's different types of sterilization. One is steam sterilization and the other is gas sterilization. And gas sterilization is for plastic. We have a lot of plastic that needs to be sterilized in our healthcare system. They don't have the opportunity to sterilize plastic over there. Gas sterilization takes a long time. It's a very expensive machine. But yes, you're right. There are places to do that.
Your warehouse need, give us some idea of how many square feet and for what term?
I would be interested in 3,000 to 5,000 square feet of dry storage for free. That's the term.
That's it.
I mean, at least at this point, for free. But I could negotiate. I could negotiate.
She's probably getting the area so they can write it off their taxes. If you have a large building, you take 5,000 feet, and they can quote unquote charge you fictitious rent.
Yes.
You can write that off their taxes, and you get the warehouse space for nothing.
I'd be happy to, and I'm a 501c3, so I can easily do that. I can send you a tax credit for that donation. Absolutely. Yep. Something within this kind of, within that, here in that 128 beltway, because that is an easy pick. What we really want to do down here in Massachusetts is go to all those little hospitals that are around this area, like in Norwood and Beverly and Salem and
Emerson.
And Emerson. I used to work at Emerson Hospital. Oh my God, that's right. That was such a great place, and it is such a great place. And we want to set those systems up in those smaller hospitals, and then we'll be able to say to BU and Beth Israel, by the way, you know, we're all over here, and then we're going to be able to move right into Boston. That's the better way to do it, is to show that we have presence down here, that we really have a system in place, and that we're organized about this. I mean, this is a big operation that's being run predominantly by volunteers, and 5 employees right now, which is incredible. Our budget is about $450,000, which will then be larger next year because we're going to hire more people. But we're trying to save it all from the dump, limit the impact on our environment, lower the cost of health care. We all know how expensive that is. And any way you can impact the cost of health care is important. And then do the right thing. And the right thing is to help people that are less fortunate than we are, whether they're here or they're overseas. Yes, sir.
What are your 2 largest sources of income?
Our 2 largest sources of income. The largest source of income right now would be our annual appeal, which has gone from $30,000 to $100,000 as of last year. And I anticipate that that will stay around the same this year. Our next largest source of income is our container processing fees that we have to charge. We're shipping at least 12 containers this year, which is 15 to 18,000 pounds per container, as I mentioned earlier. And then the other source of income that we have are small grants and some private donations that come in. We accept a lot of donations of product that people bring in, and then they have a look around and they're impressed, and they might send a $50 or $100 check. And it's amazing how that adds up over time. And then the other source is a bit of revenue, little business that we've started. Because if you're a nonprofit, you can still make money. You just have to bring that money back into your nonprofit. And so in the world, in our healthcare, we throw away major pieces of expired equipment. It's things that you use in laparoscopic surgery or endoscopic surgery. These things that they do, they stick into your stomach and they do all these things, and they're very, very expensive. And if they're expired, they throw them away. And so we collect expired goods. That's another plus, is that we'll take all of these hospitals' expired goods because they're going to throw them away anyway. And they're not in the business of looking around in our country and finding alternative sources for expired goods. And there are businesses out there, one in Illinois, where we fill up these big Gaylord boxes of certain products that they're looking for, and we send them back box loads of this stuff, and they share with us, they send us a check for $800 to $1,000 per box. We generated this year about $120,000 out of that little source of income, which is a big one. And part of that income is also included with medical schools and simulation labs for teaching nursing students and medical students. Instead of them going out and paying retail for sutures, one box of sutures, 36 sutures in one box, retail is $450.
It's very expensive.
In-date, very, very expensive. Well, they don't need in-date sutures to teach a medical student how to sew up an incision on a pig's leg, right? So they come to us, and they pay $1 a piece for the suture. So they're coming to us a lot now because they've been down there and they see all of these items that they need to use, they need to give, they need to provide for students, nursing students and medical students, so that they can learn how to use these pieces of equipment. And now they're not paying full freight for it. So they're really seeing that as an opportunity. And we are too, because it's expired stuff. And we cannot send it, and we cannot use it here, so we found an alternative way to use it.
The pharmacies?
We do not deal in anything with medications. We're not.
No, because certain pharmacies are in a hospital line equipment, and the gauze and all those things has an expiration date.
That's right. It has an expiration date. Gauze does.
Then if I approach a pharmacy, I don't know how they deal with that. I don't know if they return to the provider or.
No, I don't think they return it to the provider.
I'm going to talk to pharmacists.
Ask him, because I bet they have to discard it. We'll take the pharmacy's expired product, because we'll take it out of the package. I'm going to take that gauze out of the package and I'm going to put it in a Ziploc bag, and I'm 4x4 gauze, 25 in a bag, and I'm going to send it just the way it is. It's non-sterile gauze. Because it is. Now it's not sterile, but it's still good. And they can sterilize it over there in an autoclave. Yes, sir.
You've talked or mentioned a lot of these Boston hospitals and so forth. And what is it that you're trying to get? What type of relationship? Is this something you're looking for to get from these hospitals?
Introductions into the right people at the VP level, Vice Presidents of Nursing, Senior Vice Presidents of Nursing, Materials Management, those people that have access to the consumables and medical consumables, but also the individuals that know that they're getting rid of 20 beds, replacing 20 beds, replacing 10 incubators, replacing Hoyer lifts, replacing the EKG machine, the defibrillator, all of the biomedical equipment.
Assisted living.
Excuse me?
Assisted living. They can have that kind of changing equipment.
Yes, they do. We change our equipment often because, for example, mammogram machines. We are now, nobody wants a mammogram if it's the old-fashioned mammogram. We want digital mammograms. They're all computerized now. So what are they doing? They're getting rid of all those mammogram machines. We've had 2 mammogram machines that have been given to us, and we have been very thoughtful on where we have sent them, because a small little clinic or hospital in the middle of Zimbabwe wants a mammogram machine. But then I explained to them, but do you have chemotherapy? Can you offer chemotherapy? Can you offer radiation therapy? Well, no. Well, then it's not the right thing to do, to give a country or give some small place a mammogram machine when all they can do is diagnose breast cancer, but they cannot treat it. So you don't need to do that. That's not the right thing. That's not the ethically right thing to do. You need to give a mammogram to an organization that has the capability or the plan to develop an oncology service for their breast cancer patients. So there are lots of different things in this operation that we have to look at, that I want to look at, because I don't want to do the wrong thing. I don't want to just send it all because I just want to do good. You know, that's great. Sometimes we all feel that there are other organizations that just send it, oh, we did a great thing, but maybe you sent the wrong thing. Maybe you didn't, maybe you sent them things and they don't even know how to use it. Because we're used to using those things here, the little blue claves that connect the IV to your connect the IV tubing to your arm. They don't use those in Africa. They have no clue what that is. So we don't send them.
I may be able to help you with getting some names of people from these various hospitals.
Thank you.
Massachusetts as a separate corporation. Our biggest thing, our big fundraiser is for eye research. The separate corporation is Massachusetts Lions Eye Research. And we contribute lots of money to these particular hospitals through grants. If they have something going on that they know is promising and so forth, they can get part of that money, but
Right.
they have to have somebody to seed it and start it and so forth, which is us. So those 7 hospitals are like Mass General and Scapins and Beth Israel and Tufts and on and on and on. But again, there's 7 of them. And of course, we know everybody in that hospital that
Right.
knows something about anything, really. You know.
Yeah, they sure
Matter of
do.
fact, on this coming tomorrow night, I'm going to a Massachusetts Lions Eye Research meeting, and the president this year is Robert Haskell, and who lives, his club is in Leominster. It's Turkey Hill Lions Club. And I'll talk to him tomorrow night, so I'll give him information and so forth, and I'm sure that we can help, really.
That'd be great. I would love to come and speak to them too, because we need to let them know about the fact that we need the eye machines. And we have been given eye machines, and we have ophthalmologists in Portland that have come over to check all these machines out and said, no, that one's no good. These are. You can send them. So, as you know, the vision issues throughout the world are pretty dramatic. So we can help from a variety of different ways. So thank you very much. I'll make sure you have the information.
Make sure that you get together with Ron, so it's great.
And with crutches and walkers, all of our local senior centers are throwing them away because they only have so much storage. So when you donate, the seniors donate the new, gooder ones, the old ones are getting thrown in the dump every day.
Yeah.
Because they have no storage for
Oh
them.
my gosh. Oh my gosh.
Yep.
We need to figure out how to come down here and have a.
I'm just saying that they do that all the time.
Well, I think.
We need a day to come down here and
That's a
collect it
lot
all.
to think about. I think we could possibly maybe organize
Something like that.
something like that.
Storage.
A medical supply drop-off day,
Yeah, yeah.
and we'll bring the truck down, and then you don't have to store it anywhere, and we'll just put it in the truck. And that's a good thing. That's a good recruiting tool. I mean, you can put that in the newspaper. The Lions Club is partnering with this, and we're sending different types of things. So
Project, the wheelchairs, the walkers. Very good.
So thank you very much. I've kept you longer than your time. Thank you very much. So let me.
This here is Council on Aging.
Okay, I'll look them up. Here are some business cards. I mean, these are things that,
I want a business card from you.
yes, by all means.
Because
Here,
one
here's some.
is a eye clinic ophthalmic consultant in Boston.
Here's some business cards.